Hello everyone. This video is going to be a walkthrough of some of the questions that were on the midterm. And I'm going to actually show you how to look those up in your CPT. I'm not going to be able to walk through every question, but I am going to try to hit the ones that were asked about in the discussion. If you had other questions that you'd really like discussed or talked about in a comment or something like that, you can post them in this week's discussion as well. I'm happy to talk about them some more. The earlier you can post in the discussions, the better, because I'm more likely to have the time to during the week to respond to them and, more thoughtfully engage with you back and forth. You definitely won't lose points for posting on a Sunday night. You're just less likely to get a complete answer or get a timely response if we're posting really, really late in the week, okay? But that in mind, I'm going to try to hit several of the trickier questions from the midterm, and hopefully me walking through them will maybe be a light bulb moment for you about using the manual or some other questions you might have had about coding, okay? So let's go ahead and hit the ground running. So this question, several people missed it, and it was asked about a couple of times in the discussion. It was kind of tricky. So it says a 32-month-old toddler has been diagnosed with leukemia and will need staged chemotherapy. To perform this chemotherapy in the best manner for the child's comfort, a PICC line needs to be placed. How is the placement of the PICC line coded? So if you are in the real world and you are a coder and you have no idea what any of this means, right? It's day one. You will likely want to query the provider, do some research on what a PICC line is. How does it differ from other kinds of lines? How does it relate to chemotherapy? All of that. You'll want to figure all that information out so you can accurately code this and understand it for the future. However, we are not talking about the real world in this class. We are talking about the national exam. So if I'm on the, sitting in the national exam and I see this question and I have no idea what this means, I am still not lost, okay? Even if I do not have time to look up every single answer that's offered, I can still find the right answer for this question, okay? So what information am I going to pull from this little diagnostic statement or not diagnostic statement, treatment statement or procedure statement? What I can see right away, because it's all caps, is PICC line. So that is going to be my anchor here. I need to figure out how can I code the placement of a PICC line? Placement's pretty vague. So that might be hard if I have no idea what body system I'm even talking about. But PICC line seems pretty specific, right? So that is what I will cling to as I start looking up codes. And then the other thing that I'm noting here is that it is a 32-month-old toddler. Now they're using very specific language. They're listing the child by months and they're saying toddler. They're not saying child. They're not saying a very young child. They're saying a 32-month-old toddler. So they're really emphasizing the age of this patient. So I'm going to write that down because that might be very valuable, okay? So those are the two things that I'm going to pull out of this in order to identify the procedure, okay? If I was doing diagnosis as well, I would have other things to look at. But right now I'm just looking at the procedure codes. So what I'm looking at is placement of a PICC line and 32-month-old toddler, okay? So let's go look at the manual and see how we can figure this out. All right, so this is the information that I have. PICC line, 32-month-old toddler. So the very first thing I'm going to do, because I have no idea what body system I'm looking at, right? I don't have any idea. Chemotherapy could be related to, all kinds of different procedures. So I am not going to try to guess at this point. I'm going to go look up PICC line. I'm going to go to the index in the back. And so, like I said, placement is very general. So starting with the term placement, as a procedure would likely be very time consuming. I don't even know if it's in there. So I would just start with PICC line. Remember, this is the national exam, so we are rushing. We're doing it, well, not rushing, but we're doing it as quickly as we can. Okay, so on page 1198, about the middle of the page, we have PICC line, and it says insertion, not placement. That means the same thing though, in my mind. And then it specifies with port or without port or pump. We don't have any information about a port or pump, so we cannot assume that it is there. So we are going to look, there's 4 codes in this section. We're going to look at these without the port or pump because we cannot assume that it is there, okay? So we're looking at 36568 and 36569. 36568 and 69. I don't want to waste my time, so I'm not going to write it all out again, but that is what I'll write. And then I'm going to go look up these 2 codes. And look, I flipped right to the right page, almost as if I have been here before. All right, so on page 312, you can come to this section. You'll see that there are guidelines here about the PICC lines. This might be super helpful. There's also a table. So if I'm working heavily in this section, this table might be extremely useful for me. It might help me pick a code very, very quickly without going through each page, right? But right now, I know I'm only looking at 2 codes. And that's 36568 and 36569. And it says insertion of a PICC line without port or pump. Remember, we don't have any information about that. So we would say it's without a port or pump because it's not been mentioned in the documentation. Without imaging guidance, again, we don't know anything about imaging guidance. And so we will not say that it has imaging guidance. And then after the semicolon here, it says younger than 5 years of age. So we know that these codes are dependent on age, okay? And it looks like there's some other information here about similar procedures, but we know we're looking at a PICC line, and it looks like these are for centrally inserted or placement peripherally inserted non-tunneled central venous catheter. Okay, so these are not listed as PICC lines. They're just similar procedures, okay? But this is specified as a PICC line. And so we know that it is age dependent. So between our 2 choices, we have age 5 years or older. Remember, anything after the semicolon is what makes it different. So this is a indented code. All right, so it means that everything in this top code before the semicolon right here applies to this code. So this is also for the insertion of a PICC line without a port or pump and without imaging guidance, but this one is for people or patients who are 5 years or older. And this is for 5 years or younger. We had a 32-month-old, so we are going to pick 36568. Okay. And when you're doing it on the national exam, you'll be much quicker than that because you're not going to explain it to anybody. You're just going to very quickly go through, figure that out, that this one is for 5 years and under, this is for 5 years and older. You know, it's 32-month-old. You'll pick this one. All right. So let's go back to our PowerPoint and see if I was right. 36568 specified as for child under 5 years of age. So we were correct. All right, so let's look at the next one. And if you have questions about that, definitely post it and we will get it figured out, okay? This one I feel like was asked about a lot. And I was confused as to why, but then once I started looking more at your book and the PowerPoints and the different resources that were provided by the publisher, I was able to figure out why this one was trickier. And so we're going to go ahead and look at it. It says a patient with 2 malignant lesions on the neck, 1.5 centimeters and the other 0.8 centimeters, had both destroyed by electrosurgery. What are the correct codes to report? So what information is important here? a lot, actually. Basically, this whole statement is very important. But what we're looking at specifically is 2 lesions. So we know it's going to be something in the skin, and we know that they're malignant. So we have benign and then we have malignant. And they have 2 separate code sets. When we're looking at that integumentary system, there's generally a, whenever we're talking about lesions or tumors or anything like that, we have benign, meaning not cancerous, and malignant, meaning cancerous. So we have to be very careful when we're picking the right codes there. Make sure, because they'll be very, very similar codes, but just some are for benign and some are for malignant. So right here, we have 2 lesions. They are malignant. Also, what's important here is the location, which is the neck, because whenever we're working in the integumentary system, we specify generally the location on the body. So like might be hands, trunk, face, or they might group certain body parts together, usually face, neck, hands, and then maybe trunk, legs, and feet or something like that. They usually try to group them together, okay? Different body parts together. So it's important to know which part you're working with because that will also help you pick the right code. The other important part here is the size of the lesions. So we have a 0.5 centimeter and a 0.8 centimeter. And whenever we are dealing with anything, the removal of anything, we want to know the size of that lesion or tumor or anything like that, because that can also help with code selection. And then also the method, this has been destroyed, not excised. So we're not cutting it out, we are destroying it entirely, okay? So that's also going to help us when we are looking in this section, okay? Now, generally, I'll give you a little hint here. Whenever we're destroying something, it doesn't really matter how we're destroying it. So there's different methods of destroying lesions, and usually the codes are all going to be the same, but the difference comes into play when we're talking about destroyed or excised, okay? But destroyed means we're completely destroying it. We are not removing it. We're not doing a biopsy. We're not doing anything like that. So it's going to be destroyed, and in this case by electrosurgery. Okay, so let's go look at the manual and we will see what we can find. All right. So again, we're going to start at the front, and we already know. So in this situation, unlike the last one, we know we are looking at the skin because we're talking about lesions that are removed from the neck. So that's fairly obvious. So we're going to be in the integumentary system. So if this was me on the national exam, I would go into the integumentary system. And remember, yes, we tabbed it here, but the table of contents is here at the front with the general surgery. So if you don't remember that, you might want to put a tab there. So here is the integumentary system, and then we are going to be looking for destruction of malignant lesions, okay? Don't get confused here. We have excision right there, and I'm betting, that's what I was betting when I was reading through some of the answers. I'm betting that some people went to excision instead of destruction. Or the other thing I thought might have come up is burns, which are when we add things together. That's not the case with lesions. We're not going to add them all together. We are going to code them separately, okay? So we are going to look for destruction. And over here on the next page, we have destruction, and we have, remember, we have benign and malignant. So this is destruction of malignant lesions, and it says any method. So it really doesn't matter that it's electrosurgery. That's really the only part that didn't matter here. But it's going to send us to page 122. So we'll flip over to 122. And now we are in destruction of malignant lesions, any method. And you might note on the page before is the benign lesions, but we are here in malignant. And the first code here is, you can see, it's usually good to look at these main codes to kind of see, it's a pretty small section. So there's really only 3 codes that are describing unique services here. And then the rest are indented. So that means they all relate to this main code here, right? And it's everything before the semicolon. What's after the semicolon is what is going to make it unique, what's going to make this code unique. And it looks like in this section, we are going by size. That is what is helping us specify the right code. So this first code is destruction of malignant lesions. It specifies that it might be electrosurgery. Great, that's what we're looking for. But this code is for trunk, arms, or legs. We are looking for the neck, okay? So we will not be using these codes here. We'll skip down here, destruction of malignant lesions, again, electrosurgery, awesome. And it specifies it's for scalp, neck, hands, feet, genitalia. So they've lumped in quite a few different things, but this is going to be destruction of malignant lesions for any of these locations on the body, okay? So even if we had a lesion that was on the scalp and one that was on the neck, we could still use from this section right here, okay? All right, so what specifies the codes here are after the semicolon, lesions that are a diameter of 0.5 centimeters or less. And then the indented codes beneath it are being specified by their diameter here, the size of the lesion, okay? So here we have a 0.5 centimeter and a 0.8 centimeter. So we're gonna need 2 codes. And this first code, 17270, make sure I get that right, 17270, that is for 0.5 centimeters or less. So that's going to work here. And then our second lesion is the 0.8, and this code underneath it is for 0.6 to 0.1. And we are looking for 0.8. So that's going to fall right in between those 2 numbers. So we would pick 17271. And this is how we would report it. Okay. Sorry, that's a 0. Very messy. Okay, so let's go back and look at the PowerPoint and see if I was correct. Yep, we have 17270 and 17271. And again, if you have concerns about that, you have no idea how I got there, definitely ask me in the discussion and we will go through it. I'm guessing people were either if you missed that question, you were either looking at excision or you were getting confused with how we code burns when we add things together. We're not doing that with lesions, okay? So you might want to make a note of that if you missed it. All right, this is a very long question. This is a 6-year-old patient, recently relocated and meets for an initial visit with a new internist. This first visit is an annual preventive medicine visit. The internist provides a comprehensive history and examination, counsels the patient on diet, and orders blood work because the patient has a long history of gouty arthropathy. What are the appropriate codes to report? Okay, so there's a lot going on here. What I'm going to note that jumps out at me is that it's a 60-year-old patient. And he or she is coming for a preventive medicine visit. This is not the same thing as an office visit, okay? So if it is specified as preventive medicine, there's a section in the E&M chapter just for preventive medicine visits, okay? And he is a new patient. That's also jumping out. So if I'm on the national exam, I see there's a lot of things going on here, comprehensive history, I'm worrying about leveling, all of that. The main thing I want to find right away is what section of VNM am I going to be looking at, and preventive medicine jumps out, okay? So I am going to go and try to find that section in the manual itself. Okay, So we know we're in E&M because we are not doing any procedures. It's an office visit. So let's see if we can find the table of contents first. And you might be able to find this from the index as well if you put in preventive medicine. But if we already know what section we're in, it's usually easier just to come to the table of contents, okay? And on page 3, you'll see there is a preventive medicine services category. So we would look here first. I'm guessing if you missed this question, you were probably looking in the office or other outpatient services here in the new patient section, which would make sense. I understand why you would do that. But since we know we have a preventive medicine section, we'll check that out first. So that's on page 47. And it doesn't start all the way here at the bottom. If I'm rushing, I will probably skim this, but what really jumps out at me is the extent and focus of the services will largely depend on the age of the patient. Okay, so we know that what's going to be most important for this section is the age of the patient. That's really going to help us because we're not going to have to sit there and look at all the different levels and go to the charts. And I mean, you might be able to look at the charts as well, but if this was me, this is how I would do it. So we know we are looking at a new patient. And when we come in here, what is so great about this section is there is only one main code and everything else is indented underneath it. Okay. And what we can see very quickly, just by even skimming it, is that what sets each of these indented codes apart is the age of the patient. Okay. So all of these codes are talking about the exact same service. But what is specifying it, each code is the age of the patient. Okay. So we don't really even have to do much more work. We already know we have a new patient. It's comprehensive preventive medicine. It's the initial visit. And our patient is 60 years old. So we're just going to come down and figure out where he fits in, which is 99386. So that's the code that we would use there. And there's really no other option if we're looking in this section. So that's why it's important to know the structure of the E&M, even if you don't know exactly what each code is going to cover. Make sure you know what each section is talking about. So we know that there's a preventive medicine section. So even if we don't know what that entirely entails or how much work goes into that kind of service, we know it exists. We can go and check, and there's not a lot of options about what we can pick. We just need to know the age of the patient for that new patient section. Okay. And the same for established patient. But this would just obviously be an established patient. So that means someone they have seen within the last 3 years. All right. So let's go back to the PowerPoint and see if we got that one right as well. We can pull a hat trick today. $99386. We got it. So that is how I found those 3 questions, which were the most missed, or most asked about. If you had other concerns, you have no idea how I got any of those, let me know in the discussion and we will talk about it and figure it out together. Thank you.